Hello everyone, I am Dr. V Mohan, Chairman and Chief Diabetologist at Dr. Mohan's Diabetes Specialty Center. I am happy to talk to you today about the need for early combination therapy in general and with SGLT2s and DPP4 inhibitors in particular in the treatment of type 2 diabetes. Today we know that diabetes has become a pandemic in India. We have nearly 80 million people with diabetes in India. The prevalence of diabetes is over 8%. And if you look at the metropolitan cities like Chennai, Delhi, Mumbai, Bangalore, Hyderabad, Kolkata, etc., in people above 50 years of age, the prevalence of diabetes is almost 50% today. And overall, it's almost 25% of the adult population in these metros. Not only that, we also know that type 2 diabetes in Indians has some peculiarities. It tends to occur at a much younger age in Indians, and there is a propensity to develop complications of diabetes, particularly cardiovascular disease, at a very young age. If you look at the mean HbA1c in our population, and this comes again from the INDIAB study and from other studies like the DiabCare India study, which I was involved in, the mean A1c of our population of people with known diabetes is above 8.7, 8.8%. This means that a significant number of people will develop complications of diabetes, including retinopathy, nephropathy, neuropathy, cardiovascular disease, and peripheral vascular disease. The main reason why people develop complications is due to clinical inertia. Many studies have shown that when the treatment needs to be intensified, there is an inertia both on the part of the patient as well as the physician in intensifying the treatment. Even when the A1c remains very high, it takes 2 to 3 years, if not more, before some intensification is done. It is in this context that early and aggressive use of combination therapy has come to stay. The Verify study and many other studies have shown that if you use a combination of different oral drugs early in the course of type 2 diabetes, you can achieve the goal of A1c less than 7 and maintain it much better than if monotherapy was used. And this use of combination therapy has been approved by the American Diabetic Association, the RSSDI, and several other academic bodies. When we talk of the different oral anti-diabetic drugs that are available in the market, of course, we know that metformin is often used as the first line drug, and we do have the older drugs like the sulfonylureas and so on. They're still very useful drugs. But in the last 5 years or so, the world of diabetes has been completely shaken by the advent of two classes of drugs which have come in, the DPP4 inhibitor group as well as the SGLT2 inhibitor group. Both these groups of drugs have been shown to be completely safe from the cardiovascular safety angle, and in addition, the SGLT2 drugs have been now shown to have cardiovascular superiority and protection from heart failure as well as from cardiovascular death. And recent studies have also shown that they have a lot of other benefits like renal protection, weight loss, and reduction of the blood pressure, and so on and so forth. When the primary drugs fail, like the sulfonylureas, there is enough evidence today to suggest that by the early use of these two agents, we can get very beneficial results. It was Ralph DeFronzo who showed the famous ominous octet, which means that the pathophysiology of diabetes involves at least 8 different defects. It is very difficult with any single agent to address all these 8 different defects in type 2 diabetes. However, when a combination of a DPP4 inhibitor and an SGLT2 is combined in the use of treatment of type 2 diabetes, almost 6 or 7 of these pathophysiological defects can be addressed by combining these two agents. Moreover, by using them in combination, we can also help in weight reduction, in reducing the blood pressure, and in preventing kidney and heart complications of diabetes. We all know that when the SGLT2 inhibitors are used, there could be a chance for genital or urinary infection. But now we know that when you combine the SGLT2 with the DPP4 inhibitor, the prevalence of these genital infections are also reduced considerably. Therefore, I would like to submit that in the appropriate patient, and of course, taking cost into consideration, given that these two molecules can be expensive for some people, wherever possible in the treatment of type 2 diabetes, I would suggest that the early use of a combination of an SGLT2 inhibitor and a DPP4 inhibitor would be very much beneficial for people with diabetes, not only for control of the diabetes, but also all the other comorbidities like hypertension, obesity, and so on. I would also like to share with you some news which is just off the press. Just recently, we published a major paper in Diabetes Care, where along with my colleagues from the University of Dundee in Scotland, with Dr. Shushima Gan as the first author, and I'm also privileged to be a co-author in this particular paper, we published in Diabetes Care a meta-analysis and a systematic review which showed that the DPP4 inhibitors are more effective in Asians. Of course, I had also shown this earlier in my studies on DPP4 inhibitors. But what was new in this particular study was that the SGLT2 inhibitors were also for the first time found to be more effective in Asians compared to the non-Asians and the Caucasian population. So given that these drugs are even more effective in Indians and in Asians, I think we should encourage the use of combination of the SGLT2 inhibitor drugs and the DPP4 inhibitors in the treatment of type 2 diabetes. Thank you.